one person suggest, and I think it's a good idea, many of the participants on the webinar right now and in the Sero Project met the wonderful Channing Celeste Wayne, and Channing passed away yesterday. She was very dear to the HIV community and was part of the Grinnell Gathering. So if we can just have a few moments, a moment of silence for Channing, I would appreciate that. All right, thank you for that, everyone. So I've already set up the recording. We ask, the webinar right now is on question and answer mode, but we ask if you are not speaking, if you would please mute your phone to help keep the background noise. If somebody comes on and hasn't muted their phone, I will transition it to listen-only mode until we are ready to have questions asked. If you do have a question, if you would type it up in the chat box, and we will keep track of that, and Rosita will answer questions at the end of the webinar, and we can always go back to the slide that you are referencing. With that, I will turn it over to Sean, who will introduce Rosita and introduce the webinar.
Great, thank you, Tammy, and welcome everyone. I see we have more than 40 people on the call, which is terrific. One of the challenges with HIV criminalization advocacy work that I think almost every one of us has experienced is sort of explaining the issue to people, because so many people, immediately think that it should be a crime for someone with HIV not to disclose that prior to being intimate with someone else. And they haven't really thought through the issues of whether there's risk involved or not, or the circumstances that affect one's ability to disclose, and a whole range of other issues. Nor do they realize that the statutes and the prosecutions, for the most part, have very little to do, if anything, with whether or not there was any risk of harm or any risk of HIV transmission, let alone actual transmission, and that many of the HIV-specific statutes are simply about whether or not a person can prove they disclosed. Again, regardless of what behaviors they're engaged in, regardless of their viral load or risk they might pose of transmission or anything else. And so we found that explaining the issue and getting people to understand and to sort of join us in this reform work, advocacy work, usually involves several conversations before they kind of like process it and start to understand it. And that's just the beginning step of understanding. So what we wanted to do a little over a year ago is to talk to a broad range of people. Yes?
Sean, just to let you know, cutting in and out a little bit.
Is to do some survey research to find out from people when they are first presented with the issue of HIV criminalization. They may have never even heard the phrase before, have no idea what it means. Sort of what their thoughts were about it, and what are the kinds of messages that were most effective at getting them to think more deeply about the issue, and what were the messages that worked with different constituencies based on the part of the country they were from, or their racial background, or their gender, or their age. So we engaged a firm, Henney & Associates, to work on this. Jeff Henney is someone I've known for many years and have worked with on various other projects over the years. They've done a lot of public health research, including contracts with the Centers for Disease Control and National Institutes of Health. And Dr. Rosita Thomas from Henney Associates was the person who oversaw this project, and it was a real pleasure to get to know Rosita. Rosita has more than 20 years of experience working in public opinion research. She's moderated hundreds of focus groups and is also skilled at conducting quantitative studies like what we did. She's conducted sensitive topic research for CDC, Covered California, the DC Government Juvenile Justice Advisory Group, all sorts of other organizations, as you can see on the slide of their bio. She also worked with the American Association of Retired People, the Gallup Organization, and the Congressional Research Service at the Library of Congress. She received her PhD in political science with an emphasis on public opinion and political psychology from Yale in 1987, and she did postgraduate work at Harvard's JFK School of Government. I'm trying to slide down here. Excuse me. And she's an adjunct faculty member at George Washington University's Graduate School of Political Management and a board member of the Yale Graduate School Alumni Association. Even more important, Rosita really took this issue and this effort that we've undertaken to heart. And it was a real joy to find someone who became so enmeshed, interested, and committed to helping us find some information that would help us in our work. The study we undertook was to assess attitudes and opinions on HIV-related issues, particularly around stigma, and then specifically opinions about HIV criminalization statutes, and to test potential messages that might be used to educate and inform the general public about HIV criminalization statutes, and then determine the types of messages that are most and least effective with supporters, potential supporters, and potential opposition groups. And before I turn it over to Rosita, I see that Teresa Sullivan from Philadelphia, hi Teresa, was asking if we surveyed both HIV negative people and HIV positive people. This was a survey of the public at large, and I don't believe we asked their HIV status themselves, but there were some questions about it. We did not. So there were some questions about if they knew people with HIV and things like that. So I think we can assume that the vast majority of respondents were people who were HIV negative. So with that, I guess there was one more on the methodology. The questionnaire was designed by Jeff and Rosita with my help. We conducted the survey April 10 to April 27, 2015. It was 800 telephone interviews from a nationwide random sample. Of those, 57% were conducted by landline, 43% were cell phone. The average length of the survey, of the questionnaire, of the interview, was 22 minutes, which is quite long. And we got the sample from a firm that specializes in supplying random digit dial samples to the market research industry. And so with that, it's my pleasure to turn it over to Rosita. Welcome, Rosita.
Thank you so much. Thank you so much for that kind introduction, and thank you all for being here this afternoon to hear these very interesting and fabulous results. First, I thought I would start with a quick summary of some of the key findings, and then we'll go into some of the details again. And I am open to questions. One of my problems right now is on my screen, I can't see a chat box, so I'll have to wait until a bit later to address them. Let me start by saying that in the beginning, people have misperceptions about transmission. Most people are completely unaware of HIV criminalization. What does that mean? So this lack of awareness that the public has causes them to presume that, if there are laws in place, then they must exist for some kind of valid reason, right? And so when you look in the box on the first bullet, the initial natural inclination for most people, and it's like 8 and 10, is to say, non-disclosure is a legal matter for the criminal courts. When we ask that, everyone says, yeah, that makes sense. Of course, that makes sense. I agree with that. Again, but we have to remember that sometimes people will agree with something if they don't understand it. And this one kind of makes sense. It's a legal matter for the criminal courts, non-disclosure. Okay, that makes sense. But when we ask them about more things about HIV criminalization, people haven't really thought about it. These are complex and difficult issues. And as we went through this survey, we identified 5 groups who were initially most supportive of criminalization. In other words, these are the categories or demographic groups that you wonder, you may have to approach some of these groups differently in your messaging. And let me just say those 8 groups are below: the men, Hispanics, African Americans, conservatives, those living in the South, those who do not know anyone with HIV, those who go to church at least once a week or more, and those with a high school education or less. Okay, next slide. And what we did find is that a little information goes a long way. And it does so much to help the public understand and believe the logic behind the need for modernization. As I mentioned early on, when we first asked, if someone has, should this be a legal matter for the courts? 78% said yes. And then we gave them this bit of information. Currently, many states have criminal laws that only apply to people with HIV. Basically, these laws mean that if someone with HIV doesn't inform their sex partner prior to having sex, they can be prosecuted and jailed, even if they use condoms or do not do anything that presents the risk of infecting the other person, even if they don't infect anyone, and even if they had no intention of infecting anyone. So, when you give people that bit of information, you'll find that all of a sudden people said, 71% say, there shouldn't really be laws that treat people with HIV differently. When we give them more information about modernizing, if we tell them, look, things have changed since some of these laws came out. And here are some facts that we know about HIV today. It's a chronic manageable condition that allows those who take their HIV medications as prescribed to have a near normal life expectancy. It's not easy to get infected from a person with HIV, as some would think. For example, someone who has HIV and is taking their HIV medication is extremely unlikely to infect someone else. And then finally, we said nearly all new HIV infections come from people who either don't know they have HIV or are not taking medications for HIV. So again, this is real strong sense, we do need to modernize, 93%. And by the end of the survey, or towards the end, we read them 15 different messages. And the messages were in different categories, and I'll go in a moment. But after we did that, we re-asked the question, should there be special laws? There shouldn't be special laws that treat people with HIV differently. And that number rose from 71% to 78%. I think one of the most exciting things, though, that we found in the study was the subgroups that we initially were worried about as being most in favor of HIV criminalization. Every one of those subgroups turned around. I mean, some more than others. Men and conservatives were a little bit less supportive, but every one of them turned around. Okay, next slide. And the most effective messages that we talked about are those that said that the current laws are inconsistent with current scientific knowledge. Okay, modernization. In other words, what we have now is not consistent with what scientific knowledge. And the second most effective is the messages that talked about the unintended consequences of the current laws. And those unintended consequences are that they discourage testing, they discourage getting treatment, and they discourage disclosure. Okay? So if you look at the main part of this slide, we found out, again, the modernization law. We found out this law works particularly well, especially when we told them, look, the current HIV-specific laws don't reflect scientific knowledge, and even the AMA and other public health professionals favor modernization. So that worked really well. Let me take you to that third bullet. The civil liberty messages worked for some, but were not as effective as the modernization or public health messages. And interestingly, the civil liberty messages were less effective with African Americans, Southerners, and conservatives. And now to that middle part. When we asked messages that cause someone to think about two different things or question one part of the message that can backfire if someone questioned the validity. For example, one of the messages was modernizing these laws will save taxpayers money. Well, that people, the American public is very cynical about anything related to government, and anything that says it will save you money or make your taxes lower, people are going to dismiss. And then another one is people with HIV who are taking their HIV medications as prescribed almost never infect someone else. Well, people didn't buy that premise. And so, therefore, any message tied to that premise specifically didn't work as well. Okay, next slide. All right, let's go into some of the specific findings. I was surprised that the misperceptions about transmission still exist to the extent that they do. For example, 35% of the country still believes that there is a high chance that someone could be infected with HIV through saliva. Okay? And then if you look over on the right of that first row, you'll see the groups that are even more likely than the average, 35%, like 40% or more of these groups believe it's very likely, there's a high chance that someone could be infected with HIV through the exposure of saliva. And that's anyone 50 and older, Republicans, African Americans, those who strongly believe that non-disclosure is a matter for the courts, and those who live in rural areas. What else is interesting is that 29% do not think HIV is a manageable condition. 29%. I was very surprised, actually, that percentage was even higher among the 18 to 29-year-olds. It was 36%. And throughout the study, I was a little surprised at sort of the lack of knowledge about current research among that group. And finally, overall, country as a whole, there is little understanding of the newest science. 79% believe the risk of transmission is high if medications are taken as prescribed and condoms are not used. So there's still this belief that there's a very high risk of transmission. If someone is HIV positive, they're taking their medications as prescribed, and don't use a condom. All right, next slide. We went back and we looked at some questions about, specifically that had been asked before on stigma. And as you know, it's very live and healthy here, stigma about HIV stigma. 47% of Americans believe people get HIV because they engage in irresponsible behavior. And to the right of that are the subgroups that feel this even more strongly, or a greater percentage. Okay. On the second row, 11% of Americans believe contracting HIV is a punishment for bad behavior. 11% is high, but then you look at the subgroups, high school education or less, that's 21% of those with less than a high school education. 22% of those 65 and older, and 19% of those who go to church a lot and conservatives. I mean, basically, it's 2 in 10 of certain groups believe that this is a punishment for bad behavior. And 14% of Americans believe that those with HIV are not responsible. They don't care if they infect other people. Again, it was very surprising. High school or less, 28% feel that that's, if they see someone who's HIV, they're not responsible. And finally, on this one, 15% of Americans say they would feel ashamed if they were to learn that someone in their family had HIV. 15% of Americans. Among those who are high school educated or less, it's 30%. Okay, let's go to the next. So as disheartening as some of those findings were and are, what was so exciting about this study is that we tried to sort of say, well, what if we have a teaching moment? What if we provide some information? How will that impact people's responses? As we found, initially, as I mentioned earlier, initially 78% of the public says, without any information, these laws make sense. But then when we start giving additional information, you can see some of the changes. And it turns out that shared responsibility, if you talk about shared responsibility, and if you talk about there was no intent to harm or, versus an intent to harm, those matter to the public. So here are some interesting findings. And this is before, again, we gave them a lot of information about state criminalization laws. So the first one, when two consenting adults have sex, they should be equally responsible for preventing communicable diseases. Okay, these are strongly agreed, 88%. People should not be labeled as criminals just because they have HIV. 81% strongly agree. People with HIV should only be prosecuted if they tried to infect someone on purpose. Here we get 60%. And then people with HIV should only be prosecuted if they infected someone on purpose. 58%. So you can see how that is really changing. All right, next slide, please. This is, excuse me, let me just take a moment. This is the question, this was our pretest question, and I'll show you what happens later, but again, we had talked about this. How much do you agree or disagree with the following statement? There should not be special laws that treat people with HIV differently than people with other STDs. And here you find that 71% agree, you're right, and 46% of the public strongly agrees with this statement. We do have a hardcore 26% who's like, nah, I'm not buying it, regardless. Okay, go ahead, next slide. And then I mentioned to you that we read about 15 messages, and they are in 4 categorizations. We read messages that dealt with modernization, meaning that these laws are different. I mean, our times have changed, science has changed. We need to modernize. We asked questions and messages, told them messages that dealt with public health. In other words, what we have now is actually not doing what we want in terms of public health, and instead is hurting public health rather than helping. We've tested messages about discrimination, and we tested messages about civil liberties. And when we found, here are the 4, on the 4 types of messages, 50% or more found them convincing. The most convincing message was the one that says we need to modernize HIV laws to take into account current scientific knowledge about infection. And here we find in the dark green, 71% find this particular message very convincing. Another 24% say it's somewhat convincing. The second message is about discrimination. And the message reads, the motivations behind these laws may have been well-meaning in the past, but now they are more about discriminating against a group of people with a specific disease than improving public health. Also a pretty powerful message, not as powerful as the scientific knowledge one, but pretty powerful. 46% strongly agreeing, 26% somewhat. And then the message that says these laws undercut the message that HIV prevention is a shared responsibility. 42% strongly, 33% somewhat. And finally, prosecuting people under laws that apply only to those with HIV does nothing to improve public health and may harm it. Very convincing for over a third of the general public, and somewhat convincing for another quarter. Okay, thank you. Next slide. Now this is a tough slide to look at very in the beginning. So let me start by saying, when you see green, green means go and good. Yellow, think of it as a stoplight. Yellow is, it's kind of working, and red means it's not working at all. And what we did is remember I told you about the 8 groups that were most in favor of criminalization. So we wanted to say, well, of those 8 groups, let's see what kinds of messaging works for them. What's the strongest message? I mean, is the same message that we give to conservatives, is that going to be the same message that's going to work with African Americans? Or what do we need? What can we learn? So we found that the science message, we need to modernize and take into account the current science. And if you look down column 2, and you see, you go all the way down, everything is green. And this means it is the best of the 4 messages. This one works, and it works across all of these 8 population groups. 71% of the general public believes this, and more than 50% of everyone believes this is a strong message. It's very convincing. Okay. Now, the civil liberties, and that's the message where we talked about discrimination. That works best for men, those in the South, and those who don't know anyone with HIV. So that's the second best message. In other words, first, again, the need to modernize is the first best message. And the prosecuting does nothing to improve health. That's a tough message. It's not the best message for most, but it seems to resonate very well with those high school or less. That was the second most powerful message for those. When we talked about it, if you were very specific and said it does nothing to improve public health and actually may harm it, then it kind of worked and got through. And then the third, the public health message of shared responsibility, that was the second favorite message for the African Americans, Hispanics, conservatives, and those who are frequent churchgoers. Okay. What this slide shows, and it's just really exciting for me, and I still get excited looking at it, all of the 8 opposition groups that emerged most in favor of, that started off being most in favor of HIV criminalization at the beginning of the survey, ended up with the majority of them supporting the, taking away HIV criminalization statutes. And the percentage of the increase for their modernization was very big among a lot, smallest among Southerners and conservatives, but overall just great. So let me just walk you through how this works. So we asked this question twice. There should not be any special laws that treat people with HIV differently than those who have other STDs. And at the beginning of the survey, if you look on column 2, 46% of the total population strongly agreed with that. By the end of the survey, that number went to 59%. Now, that's a phenomenal change. Well, is it, but what happens when you look at the changes with our subgroups that we were concerned about? Men went from 41 to 57%, 13 percentage point increase. African Americans, 42 to 55%. And as you look on this last column here, you'll see that every one of those is over 50%. The biggest change, Hispanics, 36 to 64%. Now, some of that may be due to, we had some small sample size, and we did wait, so maybe some of that change is due to that, but we cannot ignore that this was a drastic change. And I think from listening in on the surveys, there were times when, if there were language was a little harder to understand, simply having a moment and helping people understand what we were saying and making sure that the messages were clear really helped bring about some informed opinions. Okay, and we can see from the South it went from 42 to 53. I'm going to go to high school or less. That was a phenomenal jump as well. I really, really was happy about that, from 37% to 55%. Okay. I've been telling you all about the opposition the opposition groups or the people that we really have to worry about. I wanted to give you a little bit of a sense of, the demographic groups that are most in favor of decriminalization, and to see how those messages worked on these folks as well. So basically, I mentioned that 71% of the general population strongly agrees that we need to modernize HIV laws to take into account current scientific knowledge about infection. So when it's 71%, you're like, well, that's very strong. But who are our strongest supporters here? Liberals, Democrats, females, and those who know someone with HIV, right? So even higher than the 70%. We're at the 80%. The discrimination message was very potent. 46% strongly agree, and liberals and those who, again, know someone with HIV, even stronger. Shared responsibility. This was strongly agreed by 40%. What was very interesting was this, again, we talked about the Latino population earlier, so this was a place where there was really a big jump, 56%. Females, 46%, West, 45%. And then the public health message, basically, prosecuting people under the laws does nothing to improve public health and may harm it. 36% strongly agree. That was very even more powerful liberals, even more powerful for those who know someone with HIV. Okay. Let me wrap up with some of the key insights here to this. There is a great, from the results here, and I've just given you a portion of what we looked at, but you can see that there is a great opportunity to change public opinion through information by informing. And because so few Americans are aware of this issue, there is an opportunity to take the lead and shape public opinion. And we have seen here in this quick 22-minute survey with folks that attitudes change quickly when respondents are provided with additional information. Early on when I said, the majority of when you first asked the public, should HIV criminalization laws, should this be a matter for the criminal courts? Most people say yes. And if you were trying to push another law in your state, you could take that kind of survey question and say, see, here's the support for it. But if you give people additional information that can be understood, especially by those at the lower education levels, it does impact public opinion. So the key is that the messaging needs to be simple, easy to understand, and to the point. And as I mentioned earlier, that some of the ideas respondents, are when they're still challenging or not clear about transmission, and they still believe that transmission can be possible through spitting on someone or even with someone who is using the medications properly, then trying to just shoot that message out and saying it's not consistent with current science, the folks are going to take a second look, and they're kind of thinking about it because it's not consistent with their mindset. So we do have to address the stigmas. We still have to keep working on that. We still have to address the misinformation that happens. And again, as we mentioned, that the modernization messages tested best. If we're trying to get rid of a lot of the criminalization laws, talk about we need to modernize this. These laws don't do what they're intended. They were made a long time ago. They could make things worse. And as we mentioned before, with the current criminalization laws, what we end up is the opposite of what we want, which is that people are less willing to get tested, less willing to disclose their status, and less willing to get treatment. Okay, so those are the basic findings I have, and I'm open to any questions.
Just a reminder for people, if you push *6, you can unmute your line.
So Wahida posed a question. Excuse me. Wahida asked suggested that we make sure that everyone on the call understands what we mean when we say
I'm here, Sean.
Okay. Do you want to pose your
Sean,
question,
I'm here.
Wahida?
Certainly.
What we mean by modernization?
Right.
I was wondering if the respondents understood, modernization to be in places where maybe there aren't HIV laws and repeal in places where there already are specific HIV laws? I mean, modernization, it sounds really cool and hip, but, you know, it only
works in those states where you're trying to repeal the current laws. But, for example, you know, if you look at there can always be instances in states where folks will want to, you know, to start up or implement or even propose new HIV criminalization laws. And if you counter that with saying, you know, this is not, you know, these laws are different than what current scientific knowledge suggests, that makes a huge difference.
Yes, I agree. I think that the study was amazing. I'm just, you know, I was just wondering. I didn't know what level of understanding the respondents had, because I'm just grasping that myself. So I was just really curious.
And I think, I mean, the answer is that most people really don't have a good understanding. And generally, if you talk to people at a more detailed level, you find out that their basic understanding of HIV transmission kind of solidified in their mind at the point at which they heard about it. So, for example, me, you know, at the 50 plus, I heard about it in the 80s. And so, you know, I have the takeaways from what happened then. What happens is that sometimes people find out, or, you know, that's when they become exposed, but they don't keep up with the literature. So they hold that opinion throughout their lifetime, unless something comes to counter it. Right? It's the same as with, I mean, the similar thing I found recently with the issue of abortion, that people of a certain age kind of had this image that most abortions, you know, were in these facilities and they were surgical, but it turns out that more than 50% are done with a pill. So, you know, they had very different perceptions about what they thought about it because of the way that it was done today, you know, very different than it was when they first became exposed to the issue.
And I think the key with the word modernization is that people, when they're told about these special laws, and they understand that the science around HIV has changed, they know that HIV is different today than it was years ago. They may not be able to tell you exactly how, but they understand that the science is different, is advanced. And so then I think there's a logic that the laws that were passed back at a time when we knew less about this virus, that those laws need to be modernized, need to be brought up to date with the science.
Hi, this is Naima from Ohio, and I just had a question because I'm listening and listening more. I can't see the slides. I'm going to ask for them later. But I was interested about the response that came from the young adults. So what was your take on that? Because I would think that with the age of computers and with smartphones, that they would have more education than people who were maybe 50 plus. But it seems like in the survey that you all did, and if I heard correctly, that they were not as educated as they should be on the issue.
Well, Sean can certainly give us some more insight on this. But you know, my first read was that you know, it's when we're hearing about we're not hearing about HIV in the same way that we did in the beginning. You know, and I would say that most young adults coming of sexual age, you know, are not seeing getting HIV as you know, a death sentence. I mean, some are, but a lot aren't. But you're not hearing it in the news in that way. So there's almost, to me, it's interesting that there is a lack of information. It's not that it's not a death sentence, but there's a lack of other information as well. John, do you have some other things to add to that?
I mean, I think that it's also interesting that in other research, it's shown that the younger someone is, the more likely they are to support, in principle, criminalizing non-disclosure. So I think there is, I think young people just have not had the same kind of education and information around HIV and absorbed maybe more of the stereotypes and the myths than the contemporary reality. A couple of other questions that were posed on the text box. If you could turn off if you could mute your microphone, I think it would help everybody hear a little better if you're not speaking. Okay, thank you. So Ashley from Empower Missouri asked if we plan any follow-up with the same people sometime later to see if the opinion helped change or if they bounced back to their original position. We did not have funding for any follow-up, so we have not done that. Ashley asked if we recommend one-on-one conversations to influence change, TV ads, or small groups. I think all of those would be helpful. I don't know that there's going to be much in the way of television advertising if anybody's going to have the kind of budget for that. My experience is that the one-on-one conversations in relatively small groups and presentations, particularly when people are hearing from people with HIV, especially people with HIV who are subjected to or threatened with prosecution, that's very helpful. Ted Kerr asks if modernization includes abolishing laws. And modernization in and of itself has not been defined in this survey other than to make the law reflect contemporary science. So it doesn't necessarily speak to whether there should be a specific law or if it's just laws in general. John from Lauderdale asked if what the response rate and the dropout rate was. I guess that's really to the completion rate on the calls, which maybe Rosita could answer that. What kind of fall off did we have? How tough was it to keep people on for the entire survey?
Yeah, that's a very good question, and let me see if I do have that. I think that is a little more buried for me. But every day we kept a log of, where we were hitting, and we had a 5 callback design. Make sure that we, again, it's a random sample. We wanted to make sure we were reflective of the U.S. population. Let me just, if you bear with me one sec, I'll see if I can locate that easily. I will let you know. But
while you're doing that, Will asks if we suggest education in the moment or educate communities as a second step. One of the ways that we have gotten this conversation underway in a number of places is by organizing community events where we'll have a public health expert, maybe a criminal defense lawyer or expert, someone with HIV, especially someone who's been subjected to prosecution, maybe someone from a service provider or policy expert, 3 or 4 people on a panel, and invite the community. We promote it through service organizations or LGBT community centers or through clinics and anywhere we can, and get people there and have a little bit of a presentation. Frequently we'll show the short HIV is Not a Crime film, the 7-minute film, which is kind of a good introduction to some of the basics of the issue. And there's some other films. There's some really great resources now. And then turn that into a discussion with the people in attendance. That's been sort of our first step when we're working in a state. And a couple people commented on, Sarah Jackson said she's amazed by the response from Southerners. And I think that's a really important message from this research for me. which is there is no group, not any group of conservatives or whatever you might think, that we should write off, that is impossible to turn around on this, because the science and public health is on our side of the issue. And so, while certain constituencies may be more challenging than others, depending on how the issue is approached in different ways, but this is not a liberal, conservative, left, right, Republican, Democrat, partisan kind of issue. It doesn't have to be, and we're seeing that in the individual states, where we're very often finding very good support in some unexpected places, including from Republican or conservative legislators in a few cases.
My name is Cynthia Taylor, and I'm asking a question because I live in New York City. Most of the adults don't get this information, especially people.
Sorry, I'm having a hard time hearing your question.
I can't hear the question either.
I would like to know, would they give information, would they give a seminar up here in New York City to the older adults and younger adults? Because majority of the time I just heard about your survey. So would you give a survey information up here in New York City?
I can't hear clearly. Can anyone hear the question clearly enough to repeat it?
No, I couldn't either. There's a lot of background noise.
Maybe if the person who is saying the question, if there's some background noise there that you could bring down, that might help. I mean, I did hear something about something about New York City.
Okay. Can you
Yes.
hear me now?
Yes.
Okay.
Yes.
Okay. The question I was asking, due to the fact that you, because you were giving a seminar and that you had talked about the seminar and the information that you had spoken about is older adults and younger adults about criminalization laws. Is there any information that we could take back, especially in New York City, with the younger adults so they would understand?
I think that one of the key things is the messages that are really addressing the misperceptions. So, I mean, addressing the misperceptions about that HIV, how it can be transmitted and can't be transmitted. That's very important. I think most, and also about the messages about the stigma. The stigma is probably not as high with the younger folks. In fact, I do remember that some of the questions that related specifically to stigma were not as high with the younger folks, but the misperceptions are very strong. And so it's really an education. And also, the fact that because of these misperceptions, there are laws on the books that punish people in a discriminatory way and punish people in a way that's different than if they had another STD.
I think a lot of this goes back to a very basic misunderstanding about the actual routes, risks, and consequences of HIV transmission. So, what the findings from the survey are telling us is that there's a lot of that just sort of basic HIV education work 101, probably especially with young people who have not gotten that adequately, is a very important step to getting them to think differently about criminalization.
I don't know to what extent there is, I don't know if this exists at all, but, are some people deciding, it's just better for me not to know my status. Now, some people have always, there has always been a subsection of folks that have that kind of belief. It's about everything, It's like I don't want to have a colonoscopy because I don't want to know my status. I don't want to have the HIV tested because I don't want to know my status. So, in that sense, really, moving people to get to know, to make sure that they're knowing there's, and letting people feel comfortable with going and getting tested and knowing that they're not going to be, not the criminal effects. In other words, knowing it's not, well, now people say, well, if I don't know, I can't be prosecuted. I can't be, put in jail. So people have to be comfortable to disclose and to get tested.
Hey, Sean, this is Scott Chavez. Can you hear me?
Yeah.
Huh?
So I have a question about. So first of all, let me just say that I'm completely on board with the modernization sort of language and that being, I think, the message that works the best. But my question is about the limitations of that message, and have we tested or will we be able to test in the future what the limitations are in terms of how far we're able to move people with a modernization message. I guess my concern is that we get some people who think, yeah, we need to modernize them, but we don't necessarily then move them to the place of we should not be using the criminal law to address a public health issue. So maybe they think, oh yeah, it's not a death sentence anymore, so therefore the punishment should only be 10 years as opposed to 25 years for exposure without disclosure. Are there limitations like that we can test to see whether maybe modernization is going to get us some of the things we want, but not get us all the way there?
Yeah, and I think that would be.
This is Rosita, and I don't know if there's plans to do that, but certainly that could be tested. And I mean, it would be very interesting to look at some of our, initial 8 groups and, maybe subsets of those and see how far can you get with that group, and what words work, what particular messages work, and how far in the modernization process can you go. Sean, I don't know if there are plans to test that.
I think we would at some point like to do additional research, and even the advocacy and sort of how we're approaching it has been evolving over the last 18 months since we initially planned this survey. But let me get caught up on a couple of the other comments and questions that have been posed in the chat box. Vanita points out that a lot of folks from the African American community do not always trust the science. And so her approach is first taking the position that we should not be criminalizing a health status, period. And then second, that for those who are insistent on doing it, the laws have to be modernized and the science applied. Teresa asks how many people were in this survey. There were 800 people nationwide surveyed. Chad was asking if Sarah is thinking of working on a campaign based on this info. The first step with us with this info is the campaign to let other people doing this work benefit from this research and sort of learn from it what we've learned and interpret it in the ways that are useful for them. I think this will inform further research, and it may inform some sort of educational campaign or efforts around that, but we don't have a specific campaign that we have created out of this. Chris Packey from San Francisco asked an interesting question from Sacramento, that if his agency wanted to mimic our survey to see how their community compares to the nation, would they be able to do that? And first, we do have these results broken out by region. So we have a Western breakout. That's not the same as Sacramento, obviously, but we do have some regional breakout. And second, we do have the questions in the survey instrument available. And I'm sure Rosita and Jeff would be happy to talk to you about what they might be able to do specifically in Sacramento if you wanted that sort of expertise involved.
Yes, and we also have the data not only by region, but also by whether or not the person lives in a large city, urban area, or a small city or town, suburban area, or rural. So we had those 4 categories as well. And you could look at the tabular data and see all the breaks and even see where there's significant differences. For example, if you wanted to see if are there big differences between large cities and those in rural areas, are there significant differences, and then try to boil it down from there. And we would be more than happy to share anything that is shareable. I think it all is.
And Rosita's contact information will be on here. Ashley asked if as people's opinions changed, did we still have a majority at the end believing that intentional transmission should be prosecuted? And I'm not sure we tested that question specifically. We sort of exempted, well, Rosita, you can address this, but I think we sort of exempted the idea of malicious intentional transmission, which is so rare that, like the doctor who injected his infant with HIV because he wanted the infant to get sick and die so he wouldn't pay child support, really like these bizarre, strange cases. That's not what we're talking about when we're talking about the phenomenon of HIV criminalization.
Right.
So,
and we asked questions like that, in the beginning prior to giving information. We maybe one or two that, if someone didn't intentionally plan to infect someone else, should they be treated differently than the person who did this intentionally? And there is and I mentioned in the talk today, the public does, care about, if someone has an intent to harm, that is very different than someone who did not have an intent to harm.
Ted suggests that roundtables where communities can maybe use this information to help create simple direct messages around updated information about HIV, how HIV is and is not transmitted, and criminalization statutes, that I think would be great. Sean, Sean McShee wrote, if you can't locate it, can you send it to me? I'll have to go back through the thread to find out what it is. We'll be happy to, though.
And someone earlier had asked me about the response rate, and I have that somewhere. I can't locate that quickly, but I know that we did fairly well. We started off by saying that we were conducting a nationwide survey to understand some public health issues, and that we were not trying to promote or sell anything. And we told them that their responses were very important, promoting better public health in their community. So we weren't, we tried very hard to make sure that they would stay on the line and become engaged, actually even before we went specifically into HIV issues. We asked them about diabetes and some other things as well, cholesterol, and not cholesterol, but diabetes, hepatitis, HPV. Are those things manageable? And then once they got interested, they stayed on.
So Joey Wynn's asking is what the next step is. Is there a national effort to get legal groups to start working on updating the laws? And of course, that is underway in different ways in different states. Joey, in Florida, Tammy Hoff was down there for several months last year. We have a very active effort there, and have a state senator, Rene Garcia, who has become our champion and intends to help lead the effort for reform in the legislature there next year. But yes, it's in all over the country this is happening. The advocacy takes shape differently in each state.
Entry and exit chimes are off.
And then, let's see. I lost track of where I was here. Sean McKee was looking for the drop-off rate, Rosita. If we can find that, we can get that to him.
Okay.
There was, now, someone suggested that I think the caller from New York, we were having a hard time hearing, that she may have also been looking for other resources about criminalization, fact sheets and things like that. We have some things on the seroproject.com website. There are other things at the Lambda Legal Defense website, Center for HIV Law and Policy, and you're also welcome to, and other places have information. you're welcome to email any of us at SARO directly, and we can help find the print material or videos or resources that would be most helpful for you.
This is Cynthia Taylor. I don't mean to interrupt you, but you were telling me that I could use the website.
The meeting is locked. No other attendees may join.
Hello?
Hello?
Yes, I can hear you.
Yes.
Go ahead.
Can you hear me?
Yes.
I would like to, because I'm in an organization, and I would like to get some information from you so I can bring it back to my organization so we can speak about it.
Okay.
I'm in New York, and the organization is called Iris House.
Oh, sure. Ingrid Floyd.
Yes.
So, several years ago, Tiffany Moore, a woman from Tennessee who was prosecuted and incarcerated on a criminalization charge, spoke at Iris House's annual forum. And if you email Tammy or me, any of us at SARO, we can get some material to you that would give you some more print and material to hand out and share with people to kind of give them the basics around HIV criminalization, how in particular it is harmful to women, and other things. So we're happy to do that. Just send us a note.
Okay, so can you give me the email address, or can you email it to me?
Sure. Info at
Project at, say that again, you're breaking up.
Info at saroproject.com, and I'll post it in the chat box as well if you can see that.
I can't see it. I'm on my smartphone.
Got it. So just info at SARO Project, SEROPROJECT, like this, saroproject.com.
Federal projects.
Correct.
Okay. Thank you so much.
No problem. Chip from Shreveport asked, how does PrEP play into the mix of responsibility of the negative person being active and caring from about their own health? That is a interesting and complicated question. It was not addressed in the survey at all. And in fact, I think as Rosita pointed out, in the survey, the concept of the science has changed. People understood. When you got into the detail of how the science changed, you started to lose people.
I see. Well, thank you so
Now,
much.
This is not.
I enjoyed this webinar.
And remember, this survey is the general public. This is not the HIV community. This is not advocates. This is just out there in the general public.
Okay. Well, I really strongly thank you for the information.
We're very happy to provide it, and I think we've addressed all the questions that were posed in the chat box. If anybody has anything additional, either for the chat box or to speak up, we're happy to stay on the line and answer what we can.
Absolutely, and thank you so much, everyone, for participating, and please feel free to reach out with any additional questions as well.
Sean and Rosita, there was one more question that somebody had, and they were wondering if you could go into a bit more detail about specific modernization messages that you used during the survey, and what were some prime examples of messages that you thought were most effective. I'm not sure what slide that is that we could share with this person.
Yeah, I'd be happy to. Let's see.
Well, one was
go ahead.
I was going to say one was tying support for modernization to organizations like the American Medical Association. saying, hey, these big, brand name institutions say these laws need to be modernized. That was effective.
Mm-hmm. And modernizing, these laws will help prevent new HIV infections in the United States. That was very effective as well. And the one that Sean mentioned, the exact wording to that was many public health associations, including the American Medical Association, favor modernizing these laws.
And there's more detail in the slide deck, which we're happy to provide. Brian Minaga from Seattle, I just saw your note as well. And we are happy to provide the slide deck to you. Anything from anyone else? Well, I think then that is it. And I want to thank Tammy and Rosita and every one of the 40-some people who joined the call. I guess we still are, almost everybody is still on the call. Very much appreciated. We are having a series of these webinars on different topics related to criminalization. I think Tammy can tell us the next one coming up maybe.
Yes, the next one coming up will be July 27th at the same time, 2 p.m. Eastern. And it will be about a summary of the HIV is Not a Crime Training Academy that we just hosted in Huntsville, Alabama. And more information will be coming out about that, but you can save the date, mark your calendars for July 27th.
Okay, does anybody have any last question or comment? Okay, then thank you all very, very much. We really appreciate your participation and hope this is useful. Hope everybody has a good 4th of July weekend.
Thank you.
Okay, bye everybody.